We begin tonight with a major move from the Pentagon. Members of the U.S. military will be required to get the COVID-19 vaccine no later than mid-September. Good evening, everyone. I'm Adam Merrill. Megan has the night off. Now, Dayton 24/7 Now's Mamie Ba reached out to the National Guard and Wright-Patterson Air Force Base about this new mandate. Mamie?
The base tells me it's waiting for implementation guidance from the DOD, and the Ohio National Guard tells me it will follow the guidance and that the COVID-19 vaccine will be added to a list of required vaccines. First federal employees, now active duty military personnel. Beginning September 15th, the COVID-19 vaccine will be mandatory.
So the services have a fair but limited amount of time to come back to the Secretary with their implementation plans for how they would go about mandatory vaccines for all their personnel.
The plan was announced by the Pentagon Monday and endorsed by President Joe Biden. Is this vaccine a necessary step to maintain military readiness?
It absolutely is. And especially now that you're seeing what's going around with Delta, it is incredibly important that all of our troops are protected.
According to the Associated Press, the Air Force says more than 65% of its active duty and 60% reserve forces are at least partially vaccinated. When I reached out to Wright-Patterson Air Force Base to ask what percentage of their personnel is fully vaccinated, it directed me to the Department of Defense. When I asked about the vaccine mandate, a spokesperson said they are waiting for implementation guidance, which comes from the DOD. I also asked the Ohio National Guard their thoughts on the vaccine mandate. It says it will add the vaccine to the full list of required vaccines. It also says we await details of the new requirement, but it is expected that all National Guard members, other than those in state active duty, will be subject to a mandatory vaccination directive to the same extent as active component personnel. The National Guard tells me some mandatory vaccinations are for measles, mumps, rubella, influenza, hepatitis A and B, and tetanus. Health officials say mandating vaccines for military personnel is nothing new.
There's actually a long history of vaccinations, not just routine on a yearly basis, but also periodic, things like anthrax, and at one point smallpox for different individuals.
For those who choose not to be vaccinated, the Pentagon says it's developing policies, and there will be a set of requirements and restrictions. Reporting live in Fairborn, Mamie Ba, Dayton 24/7 Now News.
Mamie, thank you. And Defense Secretary Lloyd Austin says the September 15th deadline could be pushed up if the vaccine receives full FDA approval or if the infection rates continue to rise.
24/7 Now is your back-to-school headquarters. As we're just days away from school starting, health officials are asking districts to rethink mask policies. Good morning and welcome. I'm Nathan Edwards. Elise is off today. Dayton Public Schools meeting today with the health commissioner. The majority of area schools say they're still leaving the mask decision up to parents, but Dayton and Montgomery County Public Health's Public Information Officer Dan Suffoletto is sounding the alarm as local Delta variant infections and hospitalizations continue to rise.
Everyone who's at school, including faculty, staff, bus drivers, students, they should all be wearing a mask, whether they're vaccinated or not. And we're also concerned about our youngest students who are not even eligible for the vaccines.
Clark County Combined Health District says if parents decide to send children to school without masks, it'll likely lead to a rapid spread of infections. Now, Centerville City Schools is requiring masks in its elementary schools. Meanwhile, Dayton Public Schools says it's still giving parents the option to send students in with or without a mask. Now, once again, the district is meeting with the health commissioner today and says if any changes are made, it will be announced later this week. The pandemic has taken on the medical community as cities and towns across the country struggle to get doctors to practice in their community. Dayton 24/7 Now's Alex King is in Warren County, where they're working to get more medical professionals in one local city.
Yeah, good morning, you guys. Premier Health is actually opening up its new center just in about 20 minutes here at 7 a.m. And this is actually on Otterbine's campus. And this is what the center offers. They offer a wide variety, of healthcare options for you. The center is a primary care office, a respiratory office, there's a lab, imaging, and then also an urgent care with occupational health as well. The facility is opening at a time when the medical field is seeing a decrease in primary care doctors, and the timing couldn't be worse as we continue to see a large number of mental and physical health cases due to the pandemic. Although Regional Medical Director Joseph Allen says this issue won't impact the new location.
Fortunately, in this new building, it won't affect us right now. Years from now, maybe as we recruit more to come in here, it could be an issue. It's possible, but right now we're fully staffed and we have some great primary care here.
This location is open to anyone in the community. Allen says this location will be convenient for senior citizens living in the area and younger patients who are a part of the Warren County Sports Complex. He says there are a lot of services offered at the center. Healthcare providers here can help with all chronic and acute illnesses. And to learn more about this, you can head to our website, Dayton247now.com, and click on this story. Stick with us because we're going to be talking more about how the pandemic has impacted the medical community coming up. Reporting live in Lebanon, Alex King, Dayton 24/7 Now News.